the risks if someone were to try this and let's say they come to during one of these procedures?
We definitely have what might be plan B, which is absorption, deep absorption. Many of us know what this is. If we're not suggestible and able to go into an altered trance state, a hypnotic state, then at the very least we can all say that we have some things or individuals that we get very deeply absorbed with. So that could be your favorite person, that could be your favorite book, your favorite movie, or your favorite place in nature. And if that's the case, we'll ascertain that earlier, 2 days before surgery, with as much time as possible, and have the person begin to use that imagery, that visualization of being in a very good place with something they're 100% familiar with, and it's of their choice. We go into a zone, we go into a happy place, we lose track of time, we forget where we are sometimes. We won't even hear our name being called.
But to clarify on that, it's actually not a coming to that would happen where we'd be concerned, because they are there, they are conscious, they can actively communicate with Rosalinda the whole time during the procedure. If for some reason pain is not effectively controlled, and we can't do so with the local anesthesia. So an important part of this is that the pain at the site of where the surgery is going on needs to be able to be controlled with lidocaine, which is the local anesthesia.
So that's, just to clarify for our audience, the lidocaine is actually injected already where they're going to be working, so the patient is numb in that area regardless.
And I think that's the key.
So that's important.
That when you're talking about hypnosis and your ability to deal with it, when you tell the patient, well, we're using local anesthetic, you shouldn't feel anything, we're going to keep you comfortable with this, then I would buy into that.
And I think it's a great example of how Western medicine is becoming more open-minded, adopting alternative modalities. I do want to bring into the conversation Kelly Painter, who actually used hypnosis in place of general anesthesia during her breast surgery. And obviously we heard the good doctor and Rosalinda talking about how it goes. From the patient's perspective, tell us about your experience.
Actually, I was approached the day before the surgery if I wanted to do it. And with my previous experience with anesthesia, getting nausea, having the chills afterwards, getting sick, and after her explaining it, and then my doctor being all for it, I said, let's do it.
And Kelly, for our audience, what procedure did you have the hypnosis for?
It was for a lumpectomy.
And then what was your experience like while you were actually having the procedure?
I was in a relaxed state, but I knew what was going on. They had a curtain in front of me, so I couldn't see it. But Rosalinda was right next to me and talking to me the whole time. And if I felt even a little pinch, I could relay it to the surgeon or to Rosalinda.
Would you do this again?
Really, honestly, I'd do it again. As a matter of fact, the first thing I said when I came out of, when I was back in the recovery was to Rosalinda, if I can tell someone else to do this, I would do it. And then a couple days later, I also said, hey, I'd do this because I had no after effects.
So I love that part of this. I love that part of this.
We call it verbal anesthesia, that it's by talking to the patient in the right way to soothe them, to comfort them. If they feel a little pinch, no problem. You supplement your local anesthesia.
It's a great combination because to provide more context for what hypnosis actually is, it puts the person in a trance-like state where they're more highly suggestible, more relaxed, and they actually do feel decreased sensitivity to pain. So this has been established in multiple clinical trials where the parts of the brain that are associated with sensory stimuli and also emotional processing show lesser activity when they're in this state. And it's not really like sleep because, as Kelly said, she was alert and awake and able to communicate. Most people would liken it to something like daydreaming. And although there are different rates to who is susceptible, everybody can be susceptible because it relates to things like being open to the idea, being motivated to try it out, and also actually higher IQ is associated with being able to be at some point hypnotized in your life. And so there's a lot of applications, not only with pain reduction, but for some people, reducing anxiety and even changing habits like smoking behaviors and losing weight.
You're not going to roll in for open heart surgery and say, look, hey docs, I just want some hypnosis. So obviously talk to your healthcare providers. But I think within 5-10 years, you may see this in more settings. I want to thank Dr. Cohen, Rosalinda, as well as Kelly for sharing this with us. Truly fascinating.